Gosens, and I'm the country director of the World Food Program in Peru since mid-2018. Anemia was on everyone's agenda, including the highest levels of government, when I arrived in country in 2018. And despite numerous investments, efforts, campaigns to reduce anemia, there were a lot of concerns around why the numbers were not coming down. And having had experience with nutrition mapping in other countries, I thought this could actually be a really useful tool for Peru to take stock and understand a little bit more who's doing what where, and how can we really get those numbers down. And, in general, it's really not just anemia. There are a number of regions in the country that still have high levels of stunting, and we're increasingly seeing alarming rates of obesity and overweight, especially among children. So really, this was an excellent opportunity to sort of do this mapping, not just of anemia, but of all key nutrition interventions. So the main objective of the nutrition mapping was really to sensitize and inform stakeholders across the board of the nutrition situation in the country. I think it was also really important and an opportunity to foster a dialogue, an informed dialogue with stakeholders, not just from government, but from civil society, UN agencies, academia, and the private sector, who are very, very engaged here in Peru. So I think really bringing together a number of actors, looking at this from a multi-sectoral perspective, I think was really one of the key objectives we wanted to achieve with this tool. I think it's also a real opportunity. The tool was originally developed to particularly look at stunting. And I think for countries such as Peru, for facing not even just a double, but even a triple burden of malnutrition, this tool is really an opportunity to look at other interventions. I think especially in what we can do to address overweight and obesity. So one of the really surprising findings from this mapping was just overall the low coverage of nutrition actions. I think in general, what we found is that all actions except for one in agriculture generally have national coverage, but the disparities between regions are really, really surprising. I think in particular, when we look at antenatal care and just overall the integrated package for health and nutrition that infants and young children should receive, the coverage extremely low. I think what was also interesting was in terms of delivery mechanisms. I think here there's high dependency on the use of the health system and health centers and health staff. And for example, when we look at the use of community agents, which is actually a mechanism we're using in some of our projects, and that's been really successful in terms of anemia reduction, is going door to door, accompanying families, sharing recipes, ensuring children are taking their iron supplements. We're seeing also very low coverage of using these types of mechanisms to deliver essential services. So I think it really, we can broaden the scope and have that discussion with health authorities and others on what additional delivery mechanisms we can use. I think also absolutely the need to do much more multi-sectorally. I think there's high dependency again on the health system. I think it's really important to get education, to get agriculture on board. And I think finally also is investments. There are budgets, but there's often low expenditures. So I think that's also something that needs to be monitored closely. Next steps, the results of the mapping have arrived at a really crucial time. I mean, Peru is a country that's been very hard hit by COVID-19. And I think also with several months of closures of health services, if already coverage was low before COVID, we can only imagine how it's been during and the impact this will have on malnutrition. We've also, in other studies that we've conducted as a World Food Program, we've found that an estimated 4 million Peruvians are facing severe food insecurity. And so these numbers are extremely worrisome. So I think we've come at an excellent time to really bring stakeholders together and look at some of these figures, and a time where needs have increased and at the same time investments will most likely decrease because of the socioeconomic impact. This mapping will be so useful to look at what are the priority actions in which we should really invest, where are the regions that need the attention most. And just last week, the government's actually announced the launch of a zero hunger plan. And so I think what we've already started to do is sharing some of these numbers with key stakeholders, and we plan to do so more, to really look at 2021 and guide program investments and investments across the board from private sector and other actors, to really look at how can we get the numbers better.